We always understood that it is not enough just to have the medical services, but that what happens to our patients, to our families outside of that is so critically important to their well-being. La Clínica itself was established in 1971, and it was a direct product of the Chicano movement, the student movement rooted in UC Berkeley. It didn't take long before we also created the behavioral health service that was an integral part of La Clínica.
It was community meetings 3 or 4 times a week, because at one level we're trying to deal with education advocacy, trying to help the system, the county, the city, and other folks recognize there's a need for mental health services for the Latino community. We were trying to bring together other students that were studying psychology, counseling, and together clarify what would be our methodology as a Chicano counseling center. How would we work in a way that'd be grounded in our cultural wisdom, our cultural intelligence? We were finally able to open up Centro Salud Mental, later Casa del Sol, in 1973.
50 years later, not only have those services been institutionalized and grown, but we've been able to extend them to other counties, Contra Costa County, Solano County, and they are a very important part of our school-based health centers.
The pandemic really increased the need for services, both in terms of volume and also in terms of severity. While we're seeing a lot of resilience, we're seeing the impact of grief and loss, social isolation, economic problems, and we're even seeing an increase in family violence for those who are the most isolated.
Se llama bipolar disorder, bipolaridad. Tenía 13 años y murió mi hermano, lo mataron aquí, los cholos, y 6 meses después murió mi papá. Yo llegué aquí a Estados Unidos y empecé como a los 14 años a empezar a tener estos problemas. No hablaba el inglés. Estuve unos días sin dormir y también sin comer y me pongo agresiva con mis amistades, disgustada, y empecé a tener los episodios de manía y de ahí mi familia me llevó a Casa del Sol. Me acuerdo que un día me molesté y tiré el medicamento, pero de ahí ellos hacerme ver que era por mi bien tomarme el medicamento para que me pudieran ayudar y no tuviera que estar en el hospital.
Our 4 programs cover a huge range of needs, starting with prevention and early intervention and community outreach. That's cultura y bienestar. Moving to more moderate symptoms, we provide care in the medical setting, integrated into primary care, and that program is called Integrated Behavioral Health. Finally, we've got 2 outpatient programs, Casa de Luz and Casa del Sol, and they're providing services for those with more severe symptoms.
Ellos están monitoreando mis movimientos, mi pensar, cómo hablo, si estoy muy acelerada hablando, si estoy muy triste o muy feliz, es un signo de que necesito ayuda.
La lavanda tiene propiedades curativas para el estrés y también el insomnio.
Being able to address the cultural and linguistic needs of our community by providing these services in the languages and the cultures that they understand has been a big benefit to our communities.
Coming in to seek help for any medical problem, including mental health problems, could be really intimidating and scary, especially when there's tons of stigma tied to getting help for mental health problems. I hope that it helps folks feel like they're being heard and that they're feeling seen in a way that's meaningful to them.
One of the most exciting things that we're doing is offering stipends so that students can come to us for training from the communities that we serve, and it's really made a difference for us.
There aren't many Latinx providers, even in the Bay Area, and La Clínica is doing a great job of training the next generation of folks.
That will help us expose them to the work that we're doing and to the impact it has on equity, diversity, social justice. The investment that you make in our organization really helps leverage our ability to serve the community in the long run. And we are able to work together to save the system money, to improve the quality of life for our patients and our community. And that's a win-win.
Cuando hay una mano amiga que te habla y que no te juzga con lo que le estás diciendo, y tienes esa ayuda, sientes mejor y dices, ¿por qué no busqué esta ayuda antes?